If you don't know me, this is Dr. Mitra. I'm an ophthalmologist in Northern California with 2 locations, one in Roseville and one in Grass Valley. Right now, I'm in my car in my Grass Valley location because I didn't want to be much later than I had promised. My practice, Capital I Medical Group, we help patients develop their best potential vision so that they can live life fully and enjoy their hobbies for years to come. And I'm glad that you joined me this morning. Today we're going to be talking about droopy or heavy eyelids. What are they and what can we do about them? So, I get this question a lot. What does it look like, first of all? So if you're looking in the mirror, and we're talking about the upper lids. So if you're looking in the mirror and there's very little distance between your lash line and the lid crease, then you have some heaviness to your eyelids. Some patients that I see essentially have the upper lid kind of a lot of excess skin that falls over the lashes, and it even covers the lashes almost completely. And so in that case, you definitely have what's called dermatochalasis, or heaviness of the eyelid. And some other patients may have a distance between their lash line and the lid crease, but what happens is when you look at the color of their eye or at their iris, the eyelid is so low it's almost covering or pretty close to the pupil. So in that case, you have droopy eyelids or ptosis. As a silent P, P-T-O-S-I-S. So there's so many different causes, and of course some other times it could be due to your brows. So if the brows are low, if you look at my lids right now, it almost looks like I have much heavier lids, much more heaviness over my eyes than I actually do. So sometimes it can be the brows. So what kind of symptoms do people have? So patients will come in and they'll say, I just feel like my eyes are heavy. Doc, I feel like by the end of the day, I'm struggling to, read. I feel like there's not as much light coming in. I'm having to use a lot more light just to be able to, read what I used to read before, and my eyes just get tired. Or I'm having to raise my eyebrows. I feel like I'm doing that most of the day. Actually, they may not even know they're doing that. So they come in and they say, I just feel like I just need to close my eyes by the time afternoon rolls around. And I look at them, and as they're looking at things, they're raising their eyebrows this much in order to clear the pupil or raise the lids out of the way. And so I kind of remind them or point out to them that what you're doing is you're recruiting your forehead. You're recruiting your brows to kind of lift your eyelids out of the way. So in those cases, obviously patients are symptomatic, or some people have trouble driving. They say that I definitely have to turn my head all the way around to see if there are cars next to me. And that's because if the lateral part of your lid is coming down, it's harder for you to see what's happening in the corner without having to turn towards it. So all of these are symptoms. So what are the treatments? If it's mild enough, and we're talking non-surgical treatment, but still a mini procedure. If the heaviness is mild enough, we can do Botox in this area in order to raise the tail of the brow a little bit and get the brows out of the way. And in fact, that kind of pulls the eyelid slightly out of the way also. Of course, that's not covered by insurance, but Botox is an option, non-surgical. Kicks in about 5 to 7 days, and definitely, helps. And the other option is surgical. So it's an outpatient procedure for blepharoplasty, or just taking care of the excess tissue, and maybe some prolapsed fat pads, like having some puffiness in the corner. That takes about 45 minutes to an hour. It is done in the surgery center. You do have IV sedation. Some surgeons will do that in their offices. I just never have. So surgery center, you're monitored the whole time. Somebody drives you and drives you back, and you recover pretty quickly from the IV sedation, but of course we don't want you driving that day. If it's due to a muscle that's kind of stretched, in the upper lid. So for instance, if your eyelid is very close to the eyelid margin is very close to the pupil, that's a little bit more extensive surgery, still the same incision, so you're going to have a line going across the, you know, the lid crease. And I have to tighten up a muscle and reposition it so that it actually holds your eyelid margin a little bit farther than where it's sitting right now. And of course, I usually add a blepharoplasty in there, so I get rid of the excess skin and superficial muscle that's there so that you have a nice clean look. There's space between the lashes and your new lid crease, and you're not recreating your eyebrows and your forehead in order to be able to see better. So I think I've promised to keep these lives short. So I think next week we can talk about, you know, what are these covered by insurance? What's the process you might have to go through? If you're noticing it on yourself, how can you approach your doctor and your either ophthalmologist or optometrist to help you figure out what how you can have surgery for this. So we'll talk about that next week. I really appreciate you joining me today, and I hope to see you next Monday at 8 a.m. I will try not to get stuck behind a big truck. Thanks, Jade, for watching. Good to see you. And also, if you would like to see me, you're in Northern California, go ahead and get on the website that I have, www.mitramd.com or capeyemed.com, CAPEYEMED. Again, I have 2 locations. Send me a question, either DM me, PM me, and then we'll try and answer it. But just imagine if you could, you know, if you're feeling these symptoms and you could be driving without feeling that heaviness, reading for longer periods of time and not having to put as much light on the books or, you know, computer or whatnot that you're looking at. So I'm here to help. So glad you joined me. I will see you next week. Thanks again.